So, Ms. Wayne, as this is your first appointment with me, I'd like to ask you a few questions and get to know a little bit about your medical history. It's also a chance for you to ask me any questions you might have.
Sure.
I understand from your GP that you have arthritis.
That's right, yes. It's in my hands and wrists mainly. The finger joints in my hands get really puffed up when they're swollen, like they are now. The pain can get so bad that it stops me doing a lot of very simple things. Things like having a shower or getting dressed. Then there's the trouble I have making breakfast. Anything where I have to grip and move my wrist, like holding the kettle and pouring, or buttering some toast. Well, you get the idea. It's not like I'm an old woman. I'm only 40.
I see. Tell me about your work.
I used to be a hairdresser, but I had to give it up after my hands started getting really bad. I couldn't just sit around the house and do nothing, though. So now I go to the local primary school where my kids are and help the children with their reading. And just lately, I've started helping out on the telephone helpline for people with disabilities. They have these special hands-free phones, so it means I can do the work without needing to use my hands so much. It's only a volunteer position, but I really feel like I'm doing something worthwhile.
Is your mobility affected at all by the arthritis?
I do have trouble getting in and out of bed or out of a bath. I also need help getting out of a chair if it's a bit low. I move around the house with the walking aid I have, and when I go out, I tend to use a wheelchair. Our car has also been modified, so at least I'm independent. I can go to the shops or out with friends.
I'm guessing you've had physiotherapy treatment before.
Yes. In the past, it's mainly consisted of heat treatment, but now I'm really interested in some sort of gentle exercises, if that's at all possible. I also really want to make sure that my hand splints are still helping and not making the condition worse.
Sure, I can look at that for you.
I've also been to an occupational therapist before. I needed help when things started getting really difficult around the house. I found her very helpful. She had lots of gadgets to help me do things like dressing and cooking, and so many good ideas about how to help with my tiredness without making the pain worse.
Okay, we can talk more about some of the techniques you use to help you at our next appointment. What about your medication?
I take analgesics for the pain mainly these days. I used to take those, those anti-inflammatory drugs, but the benefits seemed to wear off and they started making me feel sick, so I had to stop taking them. I do sometimes get a steroid injection, but not very often. It works really well at reducing the pain for a few weeks, but it hurts like hell. Dr. Wong has mentioned a steroid tablet I could take, which will work in a similar way, so we might be looking into that soon. And a couple of times a day I have an analgesic cream that I rub into my hands. I don't know if it really works very well though.
Extract 2. Questions 13 to 24. You hear a vascular surgeon talking to a new patient called Monica Patterson. The questions 13 to 24 complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Patterson. Your GP has sent you to see me because of some problems with your legs, is that right?
Yes, varicose veins, and they've just been getting worse and worse.
Right. Well, I've got some notes here from your GP, but I wonder if you could tell me in your own words when this started and what's happened so far.
Well, I guess the first time I had problems with my legs was ages ago, when I was pregnant. My son's 25 now, so that shows you how long ago it was. But everyone knows that varicose veins goes with that, don't they? They look horrible at the time, but then they usually disappear again.
And was that the case?
Well, by about a year or 18 months later, they'd gone completely. My legs were looking and feeling fine, and I was back at work then too.
Uh-huh. What do you do?
I was a chef in quite a busy restaurant, so there wasn't much opportunity for sitting around in that job, Doctor, I can tell you. But then, it must be getting on for 4 years ago now, I noticed the veins were coming back. At first I wasn't too concerned, although they seemed to get very scaly, and they itched too around the calves. I tried to follow the advice you find on websites. You know, move around at work, try to keep your feet up on a stool, and avoid crossing your legs.
Mm-hmm.
And I did insist on getting a bit of exercise every day. I always managed to fit in walking around town after the lunch service, just for about half an hour or so.
Good. And what treatments have you had so far, Mrs. Patterson?
I first went to see my GP just because they looked ghastly, and I was a bit worried about them. But he said that he could only recommend proper treatment when they got worse and were painful or I had any complications. But he did tell me I should lose some weight. That's an occupational hazard in my job.
Good advice, though.
Well, I did manage to get it down a bit. Anyway, about a year ago, my left leg really swelled up. In fact, they both look pretty nasty with the bulging veins. And you can see now, my feet and ankles are really swollen up.
Yeah.
Also, when I'm in bed, I regularly wake up with terrible cramps. Last night, I didn't know where to put myself. So, then the doctor did an ultrasound scan to see if there was a blood clot. Thankfully, that was all clear. But we agreed it was time to get my legs sorted. Yeah. The doctor arranged for me to have some injections of foam in the veins. He said it was quite a new treatment. It was just with a local anaesthetic, and I didn't have to stay in overnight, which was good. I had to wear bandages afterwards for a week or so, and then those compression stockings for another week.
And since then?
Well, that seemed to do the trick at first. They felt much better to start with, although I had awful headaches for the first few days, which I gather happens sometimes. Anyway, now they really seem to be worse than ever, so I'm back to square one. I'm thinking that either we have another go with the injections, or maybe I need to consider surgery this time. That's obviously more invasive, and I know from other people that I'd be very sore afterwards and would have to take time off work. That's a consideration too. I run my own hotel now, so I can't just close it for weeks on end, can I? So, what do you suggest now, Doctor?
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now, look at question 25. You hear a discussion between a doctor and a nurse about spastic cerebral palsy and its classifications. Hello, doctor. What is spastic cerebral palsy and how is it classified?
Well, spastic cerebral palsy is the common type of cerebral palsy that also accompanies nearly a third of other types of cerebral palsy. The damage is in the corticospinal tract or the motor cortex. This part affects the areas that receive gamma-aminobutyric acid that is an inhibitory neurotransmitter. Spastic cerebral palsy is further divided into types according to the areas of the body that it affects. In spastic diplegia, the lower limbs are affected with little to no upper body spasticity. Most people with spastic diplegia are fully ambulatory and have a scissors gait. They may also have other problems like hip problems, dislocations, crossed eyes, or strabismus. In spastic hemiplegia, one side of the body is affected, which occurs when injury occurs to muscle nerves controlled by the left side of the brain. Will cause a right body deficit, and when injury occurs to muscle nerves controlled by the right side of brain, will cause a left body deficit, vice versa. In spastic tetraplegia, all 4 limbs affected equally. These patients are least likely to be able to walk because their muscles are too tight, and they may also develop an uncontrollable shaking that affects the limbs on one side of the body that impairs normal movement.
Question 26. You hear a discussion about different dose rates of brachytherapy.
Hello, doctor. What are different dose rates of brachytherapy?
Well, brachytherapy is a form of localized radiation therapy involving the direct placement of radioactive material close to or inside a tumor. Brachytherapy varies by dose, mode of delivery, and the location of the cancer. High-dose rate brachytherapy is given over periods of 10 to 20 minutes. The radiation dose is delivered as a short burst using a remote after loading machine. Low-dose rate brachytherapy is administered at a continuous rate in sessions that can last up to 50 hours. In the pulsed dose rate brachytherapy, the radiation is usually delivered once every hour rather than continuously. Question 27. You hear a discussion between a doctor and a nurse about bariatric surgery. Hello, doctor. What are the different types of bariatric surgery?
Well, there are 4 different types of surgeries offered to patients. The main principle of adjustable gastric banding is to decrease food intake with the use of a small bracelet-like band placed around the top of the stomach. The band restricts the size of the opening from the throat to the stomach, limiting the amount of food a patient can ingest. The size of the opening can be modified using a balloon inside the band that can be inflated or deflated with saline solution according to the needs of the patient. Biliopancreatic diversion with the duodenal switch, also known as the duodenal switch, is a 3-stage procedure that involves the removal of a large part of the stomach, which makes the patient feel full after eating only a small meal, followed by rerouting of the small intestines to prevent food absorption. The 3rd step involves changing how bile and other digestive juices affect the process of digesting and absorbing calories. Roux-en-Y gastric bypass method is also used to decrease food intake and involves creating a small pouch. The food bypasses the rest of the stomach and reaches the small intestine, where it is absorbed to a much lesser degree than if it had passed through the stomach, duodenum, and upper intestine. Vertical sleeve gastrectomy procedure involves removal of most of the stomach, which not only restricts food intake and absorption, but lowers the levels of the hormone ghrelin that is responsible for appetite.
Question 28. You hear a discussion about oral lichen planus lesions.
Hello, doctor. What are the different types of oral lichen planus lesions?
Well, oral lichen planus lesions may belong to one of the following 6 types. Reticular is the common and usually asymptomatic that presents with a fine network of white lines called Wickham's striae, which are symmetrical and found on both sides of the mouth, usually over the buccal mucous membrane. Erosive consists of irregular painful ulcers covered by a yellowish pseudomembrane of fibrin, with the white striae all around the lesions. Atrophic is usually found as an ulcer covered by fibrinous exudate on an erythematous background. Bullous is the rarest type that is characterized by small or large vesicles or bulli, which break open, leaving a painful ulcer. Papular is an uncommon type, consisting of tiny raised white spots with the characteristic white striae at the periphery. The plaque lesions appear as smooth to slightly roughened whitish patches, rather like leukoplakia, found over the tongue and the inside of the cheeks. Question 29. You hear a lecture about the autoimmune diseases that affect the blood and blood vessels. What are the autoimmune diseases that affect the blood and blood vessels?
Well, polyarteritis nodosa is a severe autoimmune disease affecting the small and medium-sized arteries that become inflamed and damaged. Idiopathic thrombocytopenic purpura causes damage to the blood platelets that are essential to formation of blood clots. Antiphospholipid antibody syndrome leading to damage to blood vessels. Hemolytic anemia is caused when the immunological cells damage the blood cells.
Question 30. You hear a discussion about different types of biosensing elements. Hello, doctor. What are biosensing elements?
Well, an enzyme is a protein that has a high selectivity for a particular substrate, which it binds to, bringing about a catalytic change. Enzymes are commercially available in highly purified states and are therefore useful in the mass production of enzyme sensors. Enzymes can be fixed onto the surface of a transducer through absorption, covalent attachment, and entrapment in a gel or an electrochemically generated polymer. Antibodies, or immunosensors, are produced by B lymphocytes in response to antigenic stimuli such as foreign invaders or microbes. When used as biosensors in immunoassays, antibodies are immobilized on the surface of a transducer through covalent attachment by conjugation of amino, carboxyl, aldehyde, or sulfhydryl groups. Antibodies are sensitive to changes in potential hydrogen, ionic strength, chemical inhibitors, and temperature. Immune sensors usually employ optical, fluorescence, or acoustic transducers. Microorganisms or microbes may be used to detect the consumption of oxygen or carbon dioxide in an environment using electrochemical techniques. Microbiosensors have the advantage of being cheaper than enzymes or antibodies and are more stable. However, they may be less selective than enzymes or antibodies.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
The way that we teach clinical history taking at Warwick Medical School is to use the 4 frames. And the 4 frames are a logical way to take a comprehensive history and not miss anything out at all. So the first frame is a presenting complaint and the history of presenting complaint and the systems review and the red flags. So we encourage our students to ask an open question so they can start eliciting the symptoms from the patient. Then we would click into one system. What I mean by that is that if somebody has chest pain, for example, then you would clearly need to ask about all the cardiac symptoms once you've got a lot of detail about the patient's pain using a mnemonic such as SQUITAS, which is site, quality, intensity, timing, aggravating factors, relieving factors, and associated symptoms. I think then it's very important to ask about other systems. So we would do a systems review and then finish off by recapping the red flags. That is, for example, blood anywhere, lumps and bumps anywhere, weight loss, change in appetite, change in bowel habit. The next frame could be the past medical history. We'd ask about operations, any other significant serious conditions. They would ask about the drugs, because they would often be related to the past medical history. And they would ask about over-the-counter drugs as well, and also check on recreational drugs. We will then move on to check allergies and food intolerances. With respect to allergies, it's very important to ascertain whether the patient has any allergies, such as to penicillin, and what the nature of that allergy or reaction is. The third frame is a social history. So we'll explore the patient's social history. We'd find out how these patient's symptoms and conditions are impacting on the patient's life and occupation. We'd also need to inquire about smoking, alcohol, home circumstances as well, and occupational factors. We'd also then need to move on to the family history, particularly in relation to the presenting complaint and other serious conditions that could run in the family, such as cardiovascular disease, hypertension, or diabetes, or even asthma. The final frame is to explore the patient's values. Why is the patient worried about their condition? So there, we would need to explore the patient's ideas about what they think is going on, what concerns them most, and also to ask them about their expectations of how we can best help the patient. Then there should be an opportunity at the end to let the patient ask you further questions, but also if there's any bits of information that they would like to give you. Then usually at the end, it's a good idea to recap the main features of the history back to the patient just to check that you've got all the main facts. And then you could move on to a discussion about the management, which would include an explanation of what's going on, investigations, and follow-up.
Extract 2, questions 37 to 42. You hear GP Mabel Short discussing arthritis. You now have 90 seconds to read questions 37 to 42.
Hello, my name is Mabel Short, and as a medical practitioner, I think that it would be remiss if I didn't consider alternative medicines. One such alt remedy is acupuncture, a prominent traditional Chinese method of treatment that has taken hold of many parts of the world today. It involves insertion of thin needles through someone's skin in different parts of the body at different depths, depending on the areas affected. It is a form of complementary alternative medical management of patients. Complementary alternative medicine is defined as non-conventional treatment approaches of diseases in which the methods used vary from those that we use in hospital. Examples range from use of herbal medication, yoga, tai chi, dietary restrictions like Atkins diet, to acupuncture and cupping, among other examples. The CAM methods vary from the conventional treatment techniques since they are mostly based on the beliefs of both the healer and the patient that the treatment technique used will treat the whole body. On the other hand, the conventional medicine is approved way of treatment in that the healers undergo certain treatment of the entire body systems. Therefore, the medical professionals in conventional medicine direct their techniques and medications to specific body system or parts that are ailing, unlike the CAM that treat the whole body, mind, spirit, and soul. Another difference is that the conventional medicine is more invasive as compared to CAM, which needs less body invasion for treatment. Another difference is that not all people who seek CAM are sick. Others does so to maintain their health or when they have sought the conventional treatment but have not recovered fully. For successful acupuncture, the acupuncturist must have knowledge and skills required during the process. When someone gets sick, the acupuncturist insert the acupuncture needles appropriately in a combination that they understand in order to bring back the body's power and energy back or for restoration of body balance. Some of the acupuncturists use neuroscience to identify the acupuncture points to be areas where the nerves, muscles, and connective tissues find their stimulations. They then turn their acupuncture needles with aim of stimulation of the areas where the belief that increased stimulation increases blood circulation and, on the other hand, triggers the body's natural painkillers to relieve pain. They believe that for the body to work perfectly well and healthy, there must be harmonious maintenance of balance of life forces called qi that travel through meridians or pathways in an individual's body that can be assessed through 350 acupuncture points. When the force of life is interrupted, someone becomes ill. The needles being inserted in a person's body are of different sizes, and insertion is done depending on the site acupuncture, knowledge of acupuncturists, as well as type of disease the patient has. The needles take 3 to 15 minutes or more at the point of insertion, depending on the severity of the problem. Treatment duration also varies depending on the patient's preference and severity of the problem. Just like any other medical practice, acupuncture should be regulated. According to British Acupuncture Council, any form acupuncture should only be done by specialized acupuncturists and be governed by a recognized statutory body. For example, there are several supervisory and governing acupuncture boards. Acupuncture is legal in the United Kingdom, and the British Acupuncture Board has more than 3,000 specialized acupuncturist members. The board ensures that they are trained according to the World Health Organization guidelines. Acupuncture is used in several ways as follows: pain management, headaches, and migraines, counteracting nauseating effects of chemotherapy, sprains, blood pressure variations, dysmenorrhea, rheumatoid arthritis, and peptic ulcer disease. Acupuncture can also be used in induction of labor, treatment of dental pain, as well as reduction of risk of developing stroke. Acupuncture practice has some of the disadvantages or complications that may arise during the treatment or after. They include systemic infections, increase of bleeding in patients with unknown or known hemolytic disease and are on blood thinners, bruising and soreness on the insertion site, broken needle trauma, and atelectasis, among others. Atelectasis can occur when the needles are inserted deeply into the chest cavity or on the upper back region. As a result, they can cause injury to the lungs leading to collapse. The acupuncturist should be keen when doing the procedure to avoid any pricking on clients with bleeding disease or those on blood thinner drugs. Infections may set in through the insertion sites into the individual's system. Therefore, expertise skill of using sterilized needle and equipment is paramount during acupuncture.
That is the end of Part C. You now have 2 minutes to check your work.
Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Mr. Greg Matthews. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning.
Good morning. May I know your problem?
Well, doctor, he is Mr. Greg Matthews, my husband. Actually, he fell down yesterday morning when he was trying to put his boots on top of the staircase. He fell down 20 steps and he has lost his consciousness. He was evaluated by a local clinic and was amnestic at the time of examination. A HCT scan was taken and thereafter they referred to your hospital.
Well, what's his age?
72, doctor.
Does he drink or smoke?
No, doctor.
May I know his past medical history?
Well, he had atrial fibrillation, right hemisphere stroke last year with associated left hemiparesis and amaurosis fugax. This was followed by a right coronary artery for 98% stenosis. However, the stroke symptoms and signs were resolved. Degenerative joint disease, total replacement of right knee 2 years ago, venous stasis with no history of deep vein thrombosis.
What medications is he taking?
Lasix 40 milligrams once in a day, Zantac 150 milligrams once in a day, Lanoxin 0.125 milligrams once daily, Capoten 2.5 milligrams twice a day, Salsalate 750 milligrams thrice a day, ASA 325 milligrams once in a day, Ginsana 100 milligrams twice a day.
Is he allergic to any medicine?
No, doctor.
May I know his family history of illness?
Well, his father expired of a myocardial infarction at 70, and his mother died of complications of a dental procedure.
Well, his physical examination reports show blood pressure 157/86. Heart rate and irregular respiratory rate 12 to 20 breaths per minute. Reflexes are symmetric. Plantar responses were flexor, bilaterally. His cardiovascular regular rate and rhythm without murmur. HEENT shows abrasion over the right forehead. Extremity, distal right leg edema and erythema just above the ankle. Well, I have reviewed his previous HCT scan, which reveals a left parietal epidural hematoma. Right lower extremity revealed a fracture of the right lateral malleolus for which he was casted. I am ordering a repeat HCT scan to see if there is any change in the epidural hematoma. Upon seeing the reports, I shall suggest further treatments.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Ndamukong. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning. Good morning. Please be seated. May I know your problem? Well, doctor, I have multiple issues with my teeth due to severe dental disease. I have had many of my teeth removed. Now I have severe tooth pain. Both lower and upper teeth on my left side have been troubling me for the past 3 days. Well, what's your age? 29, doctor. What medications are you taking? I'm taking OxyContin and Vicodin for my knee pain. I need more pain medications because I do not want to use that medicine for my toothache. Are you allergic to any medicine? Yes, penicillin and codeine. Do you drink or smoke? I do not drink, but I do smoke regularly. Well, your test reports show temperature 97.9, blood pressure is 146/83, pulse is 74, respiration 16, oxygen saturation 98% on room air, and interpreted as normal. Mouth and oropharynx shows multiple denture and multiple dental caries. You have tenderness to tooth 12 as well as tooth 21. Your gums are normal. There is no erythema or swelling. There is no purulent or other discharge noted. The floor of your mouth is normal without any abscess, suggestion of Ludwig's syndrome. You have developed odontologia and multiple dental caries. Well, I am prescribing Dilaudid of 4 milligrams intramuscular, and I would suggest you go for a filling. In this treatment, the affected area of the teeth will be drilled, and the decayed substance will be removed, and the empty space will be packed with an appropriate dental filling material. Okay, doctor. Thank you.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
All right, so real quick, Mrs. Craig is a 65-year-old female. She's 1 day post-op from a total abdominal hysterectomy. No known diagnosed allergies. Vital signs have been stable today, although we've had some pain control issues. 0.5 milligrams at the allotted, Q2 hours. Last one was at 6:30, next one will be at 8:30. Okay? Liquid diet, orders to progress to a regular diet as tolerated. As well as starting oral meds as soon as she can tolerate a regular diet.
Has she been eating?
Not that I've seen today, no. She does have IV, normal saline running, 50 milliliters per hour. Okay. SCDs are applied as per policy. She has a Foley catheter. I believe that's about it. Do you have any questions?
Okay.
Question 26. Now read the question.
Bedside shift report is so important, not only to our patients, but to our staff. It creates a transparency of communication that is shared between the two caregivers in front of the patient and engaging with the patient and family if the patient requests. This allows for the patient to hear the information that is being shared and ask questions when those occur. It also allows us not only to confirm the goals that we have for the patient, for their healing and their recovery, but it allows us to engage with our patients and ask, what's the most important thing for you? What can I do for you today to make your day better?
Question 27. Now read the question.
You indicated that it was at a 7, and you're not due to have more pain medication until 8:30. And so what I'm going to do is I'm going to go back once I'm done greeting all my patients, and I'm going to check to see if there's anything the doctor has ordered for you that we might be able to give you in addition to the Dilaudid that you're already receiving. Many times physicians will order different kinds of pain medications that patients can take concurrently. I'm glad that you're splinting using the pillow to press down when you're coughing or sneezing. That also helps with pain control. Now, another non-pharmaceutical way to control pain, help alleviate it, is actually activity. It might seem counterintuitive, but making sure that your body is moving and that you're using your muscles actively helps control the pain. So if possible, I'd like to get you up this evening. Maybe if nothing else, just walk to the bathroom or maybe walk to the door and then back again. I think that might help.
Question 28. Now read the question.
In a perfect world, we'd rather that our patients not have to use the call light or even call us on our telephone. And one of the ways that we endeavor to do that is through hourly rounding, when either myself, a nurse, or a patient care tech will check on the patients. Perfect. So when you press that red button, it rings at the unit desk, and someone will come on the line and ask what you might need. Does that sound like something you can do?
I can do that.
Terrific. So what I'm going to do next is update my name and number there on the board, all right? A patient always feels better the more information they have. And we strive to do that, for example, with our communication board. We actively update the communication board and point to it as a way for them to call us whenever they need help with something or have a question that needs to be answered.
Question 29. Now read the question.
We utilize hourly rounding and bedside shift report not only to enhance the patient experience by creating a safe environment and a healing environment for them, but it creates trust in the care team that is caring for the patient. Our eye care values integrity, compassion, accountability, respect, and excellence are mirrored in these efforts as we create an exceptional care experience for every patient and family member, I might add, every day with a spirit of warmth, friendliness, and personal pride.
Question 30. Now read the question.
We set a comfort goal for 3. What's your pain level at right now, Mrs. Craig? On a scale of 0 to 10, how do you feel?
About a 7.
About a 7. Okay. She's on a liquid diet.
Is she taking anything for the pain?
She is. She has ordered 0.5 milligrams of Dilaudid IV as needed every 2 hours. And she did receive that about 6:30. I updated the board, so the next one due, Mrs. Craig, would be about 8:30 this evening. She's also been using splinting, which has helped with the abdominal pain. She's on a clear liquid diet with orders to progress to a regular diet as tolerated.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best, according to what you hear. Complete your answers as you listen. Now look at extract.
I wrote a prescription for antibiotics. Okay. I did want to talk to you, though. I'm a little bit concerned looking through his chart at how many ear infections he's had recently, and I noticed that you had checked the box that someone's smoking in the home, so I was wondering if you can tell me a little more about that.
Well, it's just me and him, and I do smoke. I try really hard not to smoke around him, but I've been smoking for 10 years, except when I was pregnant with him, but it's so stressful being a single mom and having a full-time job, and so it's just, that's why I started smoking again.
You have a lot of things going on, and smoking's kind of a way to relax and de-stress.
Yes, yeah. Some people have a glass of wine, I have a cigarette.
Sure. And it sounds like you're trying not to smoke around him. Why did you make that decision?
I know it's not good for him. I mean, I've read those things about ear infections and asthma and stuff, but other kids have ear infections and their parents don't smoke.
So on the one hand, you're worried about how your smoking might be affecting him, and on the other hand, you're not so sure if it's really the smoking that's causing these problems.
Right. Yeah. I mean, he doesn't have asthma. He hasn't had a lot of other problems that his other friends have. So, and I've thought about quitting before in the past, but I just don't see how it's possible right now.
What made you decide to quit smoking when you were pregnant?
Well, he was inside me and we were sharing everything, and I knew that he would get some of that, and I just didn't think I could live with myself if something happened to him.
Right now, though, it feels almost too difficult to even manage or even to try.
Yeah, exactly.
How were you successful when you quit before?
I don't know. I think about it now, I don't even know how I did it. I just did it. You know, I just couldn't imagine like him not being born or going into labor early and him having problems and stuff like that, all the stuff that they talk about with women who smoke. So that was just enough to say, okay, you know what, I'm not going to risk that. So
the risks were so scary then that you're able to stop. Like,
yeah.
They don't feel as scary to you now.
No, I mean, we're two separate people, and like I said, I try really hard not to smoke around him. I'm pretty good about that. I don't let other people smoke around him. So
You're doing the best you can do.
Yes. Yeah.
Okay, but it sounds to me too like part of you really does want to quit.
Yeah, I know that I need to, and I keep every new year I say, okay, this year I'm going to quit smoking, but then something happens and it just doesn't.
It's on your to-do list. It's just not making it to the top.
Yeah.
If you did decide to quit, on a scale of 1 to 10, where 1 is not at all confident, you don't think you could do it, and 10 is you feel pretty certain that you could, where do you think you fall right now?
Probably like a 5. Kind of in the unsure area. Like, I know I've done it before, so I know I can do it, but at the same time, it just seems really hard, and it's not the same situation.
Well, what made you say 5 rather than 2 or 3?
I know all the ways it's bad for me, and I don't want him to grow up thinking that it's okay to smoke. I don't want him to use any kind of, I don't want him to chew or anything like that. So I know I need to, especially before he gets old enough to understand what mommy's doing, but I just don't know if I can do it.
Okay. So it sounds like you have a lot of reasons why you'd like to quit. You have been successful quitting in the past, and right now you're just feeling a little bit hesitant about your ability to do it.
Yeah.
Where do you think we should go from here?
I don't know. I'd like some help. I just don't know what kind of help I need.
Sure. Well, if you'd be interested, that's something I can definitely talk to you about. There are a lot of new options that can actually help people be way more successful in their attempt at quitting. There's different medications you can try.
I don't like medicine.
Okay. There's also a lot of support groups and classes that you can take where you have other people to go through it with you, and sometimes just having that support can be a big part of it, especially for people like you where smoking is such a stress reliever.
That sounds nice, but I'm not sure if I have the time for all that.
Sure. It feels like something that would take up a lot of time and maybe not fit into your life. I wonder if we could talk about some options that might fit into your life.
That would be really nice.
Okay, well, if you're willing, then we could set up another appointment where you could come in and we could talk more about that.
I would like that. That would be great.
Great.
Thank you.
Sure.
Now, look at extract 2. Questions 37 to 42. You hear the monologue of a physician giving a lecture on ankle fractures. You have 90 seconds to read questions 37 to 42.
Hello, Doctor. What are the types of ankle fractures?
There are different types of ankle fractures, and treatments vary significantly based on the location and severity of the injury. When a broken ankle occurs, the injury may be to the end of the medial malleolus, called tibia, or to the lateral malleolus, called or both. There are many types of ankle fractures, and let me explain you about certain common types ankle fractures. Lateral malleolus fractures is the ankle fracture that involves only fibula. Most of the lateral malleolus fractures can be treated without surgery if the ankle joint remains stable. A surgery is recommended in case of an unstable joint or the ligaments are damaged. However, the hint for surgical recommendation is when the fibular fracture is within 4 centimeters of the end of the bone. In such case, the fracture can be treated non-surgically if there is no injury on the inner part of the ankle. Medial malleolus fractures involves only tibia. This fracture occurs to the bone on the end of the tibia, which is called the medial malleolus. An isolated medial malleolus fracture is very rare compared with an isolated lateral malleolus fracture. Generally, a displaced medial malleolus fracture is treated with surgery. Bimalleolar ankle fractures involves both fibula and tibia that occur when there is an injury to both the inner and the outer side of the ankle, always resulting in an unstable ankle joint, and surgery is to be recommended for most of the patients with this kind of fracture. Even if the fracture heals without a perfect positioning, the ankle joint alignment will remain disturbed and could result in accelerated arthritis of the ankle. Even after a surgery, ankle cartilage can be damaged at the time of the fracture, resulting in arthritis. Therefore, a proper diagnosis and repair of these fractures is essential to avoid the chance of long-term problems. Although a bimalleolar equivalent fracture involves only fibula, there is also a tear of the ligaments on the inner side of the ankle, resulting in instability of the ankle joint. Therefore, a surgery is essential. Trimalleolar fracture involves both fibula and tibia like a bimalleolar ankle fracture. However, the bone in the back of the tibia called the posterior malleolus is also fractured. At times, if a large fragment of bone is fractured, a surgery is inevitable. Posterior malleolus fracture involves only tibia. This is a rare injury in isolation. Fractures of the posterior malleolus generally occur in association with bimalleolar ankle fractures. In such case, the injury is called a trimalleolar ankle fracture. Mesonerve fracture involves both fibula and tibia, which is a less common injury. However, this injury needs to be diagnosed thoroughly, as there are chances of missing this injury. In this type of fracture, the bone is injured on the inner side of the ankle, called the medial malleolus. The force of this injury passes through the large ligament that connects the two bones of the leg, called the syndesmosis. Since the damage is caused to this supporting ligament, the ankle becomes unstable, and most often a surgery is recommended. This is the end of Part C. You now have 2 minutes to check your answers.